Good afternoon, everyone. This is Saro Arakin as your clinical pharmacist. So in this video, I'm going to talk about diabetes risk factors. This is very important because diabetes affects many a number of patients in the United States, whether alone or through other comorbidities. And if not treated, it can give you a lot of headache and reduce your quality of life. So as far as the risk factors, some include age. The risk of type 2 diabetes increases with age, especially after 45 years old. Family history, if you have family history of having a parent or siblings that has diabetes, having a risk of having diabetes goes up. Ethnicity, certain ethnic groups have a higher risk, including African Americans, American Indians, Asian Americans, Hispanics, Latinos, and Pacific Islanders have high risk of having diabetes. History of gestational diabetes. Women who have had gestational diabetes are higher risk of developing diabetes later on in life. So these are the women that have had diabetes during birth, giving birth, or pregnancy, and these patients have higher risk of having diabetes later on in life. Modifiable risk factors. This is very important for those individuals that can actually make a change or make an impact in their life to improve these. So weight, number one is weight. So being overweight or obese is a major risk factor. Losing even a small amount of weight, 7 to 10%, can significantly lower your risk. So this is the most important thing you can do as a patient with diabetes, to reduce your weight. That may come with physical activity, which is number two. A sedentary lifestyle and lack of physical activity increases the risks. So you need to be at least aiming for at least 150 minutes of moderate aerobic activity per week, such as brisk walking or cycling. This is like 30 minutes per day, any activity you can do. Diet high in unhealthy fats and calories and low in fiber can increase your risk. So eating more fruits and vegetables and whole grain can help. High blood pressure and cholesterol as comorbidities, having them can increase the risk of also diabetes. Pre-diabetes, this is a condition where blood sugar levels are higher than normal, but you're not at the risk of type 2 diabetes, but you're very close. This is where you really have to lose the weight and manage with activities. How to lower your risk? Be physically active, as I mentioned, 150 minutes a week minimum. Lose weight. If overweight, lose about 7 to 10% of your body weight to lower your risk. And eat healthy, as I mentioned, fruits and vegetables as much as possible, and limit fat. For more detailed information on this, make sure to comment on the video with your questions, and I'll be happy to guide you and answer any questions you may have on how to manage your diabetes and reducing any of these risk factors. Hope you enjoyed this video. As always, stay safe and take your medications.